here once more to orient your fitness in the right direction. And I'm here with my assistant today. I got his arm, and I'm going to be going over with you how biceps tendonitis happens. So, in case you don't know, which you probably do, but your biceps is this muscle right here, right there. That's the biceps. You got two heads associated with the biceps. You got your long head and the short head. So your long head starts here at the glenoid rim, and it comes down between two structures here called the greater and lesser tubercle. And it runs through the bicipital groove right here. Your long head does. And it comes down. And it attaches to your bone, a bone in your arm called the radius, right there. So, your short head, it starts on your shoulder blade here on a part called the coracoid process. And then it comes down a little bit inwards of the long head of the biceps. They join in the middle of the arm. Then they attach to the radius bone. So your biceps muscle, it helps to assist in shoulder flexion. So bringing your arm up like that. It rotates your arm so that your palm is up like you're holding a bowl of soup. So it supinates your arm. And obviously it flexes your arm too, like that. So now that you know what the biceps does, I'm going to go over how tendonitis happens, or how your biceps tendon gets inflamed. If it is inflamed, you will probably feel a deep ache on the top of your shoulder, the front, and it could spread down, pain, achy pain, down your arm into the muscle itself. So one way that biceps tendonitis can obviously happen is you use it too much. So you work out too much in the gym, you do tons of overhead activities like that. Just overworking it can lead to tendonitis and inflammation. Another way that this can happen is through a direct blow to your biceps. So say someone punches you, it's hit directly, you fall off your bike and you smash your shoulder on the ground. That can cause biceps tendonitis as well, because obviously it can inflame it, and you could possibly tear a ligament, because the long head of the biceps, it travels through this space between the lesser and greater tubercles in your arm. So this is held in place, the long head of the biceps is, by your transverse humeral ligament, which runs across here. So if you tear that ligament, then your long head of the biceps could slip around in there and become inflamed. And tendonitis could happen that way as well. Another way that you could get biceps tendonitis is through your shoulder not being stable. So say in the gym you do a lot of lat pull downs behind the head. You just got to think about basic kinesiology and movement here. Because when you lift your arm up, your arm is like a ball in a socket. So when you lift your arm up like this to the side, the ball is going down. Then when you externally rotate your arm like that, the ball's coming forward. So if you have the lat pull down bar and it's behind your head and you keep going down like that, you keep jamming that ball forward a lot, and it's creating a lot of tension. And over time, that could loosen the front of your shoulder. Then your biceps tendon has to overwork along with your rotator cuff to stabilize your arm. And over time, that's going to cause the biceps to be inflamed. Other exercises in the gym that could cause that could be dips if you're going far back. It could be the chest fly machine, you're going too far back. That creates a lot of tension. There's many different exercises that could cause you to become unstable at the shoulder. Another thing that can cause your biceps to be inflamed is something called shoulder impingement. So you got a space in your shoulder here between the top part of your arm, or the humerus, the top part. Your upper arm is called the humerus. So you got a space between the top part of your humerus and your shoulder blade, a spot here called the acromion. So within this space, you have your long head of the biceps. It travels through there. So if you do tons of overhead activities like swimming, or you do weights like this in the gym with your thumbs down, and then you come up, that's narrowing the space. So whenever you do, for your anterior deltoid, when you bring your arms up like that, you're doing front raises. Don't do them with your thumbs down. Do them with your thumbs up. Because when you do them with your thumbs down, you're narrowing the space even more and you keep pinching it. Some pinching goes on here naturally, but if you constantly do this again and again and again, it's going to get inflamed over time. Other ways that impingement could happen is you're in bad posture a lot. You have shoulder instability. That can cause shoulder impingement. So basically pinching the structures in here, when they become pinched too much, they could get inflamed. When they become inflamed, they get bigger. When they get bigger, there's less room in there. Then your long head of the biceps get impinged, and then that can lead to inflammation. So shoulder impingement can lead to it, and if you damage your rotator cuff, that can lead to your long head of the biceps becoming inflamed too, because then this bone is going to move around more in your shoulder, and then your long head of the biceps can become inflamed by that happening. Alright guys, I hope that was instructional for you. I hope that taught you something, and hopefully you know more about biceps tendonitis more. This has been Jeff, once more, orienting your fitness in the right direction. If you like this video, please thumb it up, comment, and subscribe to my channel. Thank you, and I'll see you guys next time.